Sun is going to come back out. When it does, make sure you have that sunscreen out there, especially on your neck, your face, and spray it all over the kids.
Yeah, and Fox 28's Mario Gonzalez, he joins us live from Derma Center, MD in Elkhart. Now, Mario, it's Skin Cancer Awareness Month, and doctors have seen it happen to people at any age, at any time in their lives. Everyone really can be a target.
And today is Melanoma Monday, and that's meant to just raise awareness for skin cancers. May is Skin Cancer Awareness Month, and melanoma, though, that's one of the deadliest forms of skin cancers. It kills thousands of Americans every year, so it's very important that you protect yourself and your kids when you're outside in that sun. And to tell us more about that, I'm joined by Dr. Roger Moore. Now, Dr. Moore, let's say a family's out at a beach, maybe at a baseball game. I mean, how long does it take for the sun to just start making an impact on our skin?
It doesn't take very long. They claim that any amount of sun can cause a small amount of damage. And if you're tan at any level, that means you've had some sun damage due to your time that's been in the sun.
And for people who do want to have that tan and do it in the healthy, safe way, how do they go about doing that?
Well, we tell them first that tan is a naughty word in dermatology. We don't like a tan because the tan actually signifies that your skin has reacted too much sun. So we like to protect as much as we can. If people insist on having a tan, you want to do as minimal as possible and to do it very gradual. Ideally, we'd like to protect the skin with sunscreen, hats, and avoidance at the peak times of the day, including that time between 10 and 4 when the sun is at its worst.
So during that time, it's very important, especially if kids maybe find some shade if you're out at the beach, things like that, kind of get away from it for a little while.
Absolutely. You want to kind of protect yourself as much as you possibly can. And also, whenever you're using the sunscreen, you want to make sure that you're applying enough of the sunscreen. Most people don't put enough sunscreen on when they go out to the beach or they go out to a ball game. They put a small amount on, and they actually get more sun and sun damage than what they really anticipate that they should get.
And then if you do take in a little bit too much sun, the way to heal that, it's, sunburn, what do you do?
Absolutely. If you get an acute sunburn, it's pretty significant. Taking ibuprofen or one of the non-steroidals by mouth can actually shut down that inflammatory cascade. In addition to that, if it's a mild sunburn, using topical anti-inflammatories, sometimes topical cortisone. Some people feel like aloe vera is helpful, but you have to be a little bit cautious because occasionally people get sensitive or irritated from the aloe.
And then indoor tanning, you've just mentioned that tanning is already a bad word. Indoor tanning, is that any better?
Right. Indoor tanning is a tough one. In dermatology, it's one of those things that we try to encourage people to avoid as much as possible. All forms of tanning, and even the indoor tanning. In fact, the indoor tanning, they claim if people use that, they're 2.5 times higher likelihood to getting a squamous cell carcinoma. And then there's some evidence that indicates that melanoma is increased in people who tan very frequently, including indoor tanning beds.
Well, Dr. Moore, thank you for joining us this morning. Again, Melanoma Monday, meant to raise awareness for Skin Cancer Awareness Month. Steve Farron, back to you.